Hi, everyone. My name is Jillian Parker, and today I am joined by Dr. Kalia, who is an interventional pain and cancer rehabilitation specialist at the Lipson Cancer Institute. And today we're discussing a new cancer pain and rehabilitation program that just launched earlier this month at the Lipson Cancer Institute. It's the first of its kind in our region, combining experts from both the Lipson Cancer Institute and Neurosciences Institute. Dr. Kalia, thanks so much for joining us to talk a bit about it.
Thank you so much for having me, Jillian.
And I just want to invite anyone who's tuning in to leave any questions that you might have in the comment section. We'll circle back around at the end to get to any of those questions that you might have left for us. So Dr. Kalia, let's just jump right in. It's estimated that 50 to 75% of cancer patients experience pain at varying stages of their cancer diagnosis and treatment. So can you talk a bit about pain as a symptom of cancer and what that can be like for patients?
Sure. So cancer pain can be quite a debilitating feature of either the cancer itself or the treatments for cancer. It can significantly compromise a patient's function and quality of life. So it's really important to identify and treat cancer pain syndromes in a timely manner.
Now this program's brand new. I know we said it's the first of its kind in our region, combining both the cancer pain aspect and the rehabilitation program aspect of it together. Can you explain exactly what the program is and what it will mean for our patients to have this here in our region?
Sure. So this is a holistic approach to interdisciplinary precision medicine. We individualize treatment plans based on patients' cancer, based on patients' cancer syndromes, and how they are affecting their quality of life and function. So we have brought in the experts from individual specialties ranging from palliative care, rehabilitation medicine, and the goal is to develop a common plan which can help improve not only patients' quality of life function, but also help manage their pain in a much more holistic way.
So those are a couple of the benefits. Are there any additional benefits that you want to mention for those who are actively seeking treatment?
So I think the key here is to focus on what we call precision medicine and individualized care. We know that every cancer is unique, and every cancer will present itself in a unique pain presentation, or the treatments which are so unique to those cancers will have very specific impairments if they come in, and it's really important to make a diagnosis and develop a comprehensive plan of care for these patients.
So once the diagnosis, a plan is put into place, how is it that rehabilitation becomes integrated into the program and their treatment?
That's an excellent question. So we all know that cancer itself or the treatments for cancer can lead to a lot of functional impairments, which can further affect the quality of life of these patients and also inhibit their ability to participate not only in their cancer treatments, but also their social life. So a rehabilitation medicine specialist identifies all the impairments which are happening due to either cancer or cancer-related treatments, and comes up with a comprehensive plan ranging from involvement of physical therapists or experts in occupational medicine or occupational therapy, and not to mention the important role a behaviorally focused model of care plays an important role in completing the rehabilitation model of care as well.
I know that treatment for cancer pain has really evolved over the last couple of years. Can you go into detail about, what those treatments are, how they've evolved, and, what RRH is doing to be a part of those evolving treatment options?
Yeah. So, historically, we treated cancer pain like any other pain. and our focus was only on medications. Over the last couple of decades, we have made a lot of progress through innovation to understand different pathways of modulation of pain in the body. So we can be very specific, not only from a medication standpoint, but from an interventional standpoint. So now the cancer pain compendium of care can be divided into four basic categories. You have a medical model of care where you use different classes of medications to optimize pain. The second model is what we call an interventional model, where we use highly advanced, minimally invasive techniques under the ultrasound guidance or X-ray guidance with highly precise, targeted delivery of interventions around specific nerves, which are carrying the pain signal through different parts of the body. The third is what we call a rehabilitation model of care, where we identify the functional impairments and devise a comprehensive rehabilitation plan for our patients. And finally, behavioral model. We know that chronic pain or even acute pain has a lot of central aspect. It can affect your mood. It can affect your other biopsychosocial aspects of your life, which can further lead to a vicious cycle of pain. So it's important to address those issues through behaviorally focused model of care as well, including cognitive behavioral therapy, sometimes motivational interviewing, and also incorporating in our alternate medical approaches like acupuncture, yoga, and so on and so forth.
Again, we have Dr. Kalia joining us today to talk about the new cancer pain and rehabilitation program that launched earlier this month at the Lipson Cancer Institute. And we can't not bring up COVID-19. So can you explain to me how COVID-19 has impacted cancer treatment and pain management?
Yeah, Jillian. So I think we all are living in unprecedented times. I think we'll have stories to tell our grandchildren about the last, year and a half, how we all have kind of coped and went through this pandemic, and it's still ongoing. And we are seeing all these different aspects of pandemic in different delivery of healthcare models, and cancer patients were also affected with this pandemic. We as a health system, and also as a department and a division, we pivoted and identified the barriers pretty quickly and incorporated innovative methods of reaching our cancer patients through telemedicine, and incorporated that such nicely into our compendium of care that some of the barriers where patients who were living too far or who were not able to get to the locations, we were able to offer our treatments in a much more holistic way right into their homes. It's really important to continue the treatments, especially cancer pain management for these patients, because that will allow them to not only manage their pain, but also keep a check on their quality of life and allow them to continue their cancer treatments as well.
Were you finding that people were choosing to skip care at all for pain treatment with cancer? And why is it important? What do you want people to know, cancer patients in particular, to know about not putting off pain management care, especially, that's one of the more susceptible groups, as we've been told?
Yeah, so we saw all those different aspects. I think people were afraid, rightly so. They didn't want to expose themselves to the virus by getting out of the house, especially in that vulnerable situation where they are either undergoing chemotherapy and their defense mechanism, their immune mechanism is low to begin with, and they're more susceptible to catching infections. And patients were also afraid because there was no good evidence around, what to expect. I think all our societies and our different specialties have kind of come together, and now we have good evidence to continue to offer our treatments for our cancer patients and make sure that they continue with their cancer treatments while we are managing their cancer pain and continuing them through the compendium of rehabilitation care.
Can you expand upon a little bit more on the collaboration between the Lipson Cancer Institute team and the Neuroscience Institute team, and what that really means for our patients in terms of what different specialists that they'll have access to throughout their progress?
Yeah, so it's one of a kind program, as you mentioned earlier, where we have tried to bring in all the specialists under the same roof. So we know the Lipson Cancer Institute already has the oncology services, radiation oncology, surgical oncology, but this is an effort to bring in palliative care, cancer pain, rehabilitation medicine, and some of the other alternative medicine approaches under the same roof, where we can collaborate and offer a much more cohesive and collaborative plan of care for our cancer patients.
Is there anything you want those experiencing cancer-related pain in particular to know that we haven't touched on?
I think what I would like to say is pain can sometimes be inevitable related to cancer or cancer treatments, but suffering is optional. So reach out to your oncologist, reach out to your doctors, and seek treatment. Cancer pain is treatable.
What are you most looking forward to about the fact that, this program has kicked off, these teams are collaborating, and, is there anything that you are in particular looking forward to in terms of bringing a specific type of care to patients in one space that maybe they haven't had before?
Yeah, I'm more enthusiastic about this collaborative and integrated model of care where we can offer more innovative treatments to our cancer patients in the community.
Is there anything else before I let you go that we haven't touched on that you wanted to add?
I think I would just echo my previous comments that, cancer pain is treatable. So talk to your doctors, talk to your oncologists, talk to your advocates who can help you get through, and we can offer a good compendium of care for your cancer pain and rehabilitation needs.
Awesome. Dr. Kalia, thank you so much for joining us to talk about the new cancer pain and rehabilitation program.
It was my pleasure. Thank you.
And again, if you're still tuning in, or if you're watching this after the live feed has ended, still feel free to leave any questions you might have in the comment section, and we will get back to them at a later time. Thanks so much for tuning in.